Good morning, everyone, and welcome to today's live session with FASA. Joining me today is clinical development expert Dr. Jacques Snyman, who is a medical director of Agility Health, and he's also the medical advisor to Health Square Medical Scheme. Dr. Snyman is the former head of pharmacology at the University of Pretoria, a role he has served in for some 20 years. And he is also the past president of the South African Society for Basic and Clinical Pharmacology. So good morning and welcome to you, Dr. Jacques Snyman.
Morning, Romy, and morning, listeners.
Good morning, everyone, and welcome as well. If you have any questions or you want to pop a note to say hi, please do so at any point in time. We'll answer your questions as best possible. So today we're going to be discussing medical aid and what to look for when choosing a medical aid scheme for your business. So thankfully, we've got Dr. Jacques to help us answer these questions. For businesses that provide medical aid for their staff members, what should employers look for when choosing a medical aid scheme?
Well, first of all, I think they need to understand what the business they are in, where are they located, and what do they really need. It's often easier that medical scheme selection is often a knee-jerk reaction, is to say almost a discussion that you have somewhere, and you say, what do you think I should have? And it becomes a human resources discussion instead of it becoming a real analytical decision around what's the need. Do I run a manufacturing company, and this manufacturing company is a bit out in the sticks, and what will the cover in this particular area be, and will that cover be sufficient for my workforce? And those are the very important things. And sometimes you can get very good decisions from just looking at that. Do I need certain savings accounts? Do I just need a classical medical scheme or traditional? So all of those decisions needs to be taken into account. What can I afford? And is what I can afford sufficient to cover my employees? If I've got a very young employee base versus a very old employee base, all of those need to be taken into consideration.
Okay, so when you say what is the location, why is it location based, if I may ask?
So if for instance you have a mining operation or a forestry operation, there's no sense in having a benefit that you can only access within a city. I would love to have that access or something that makes sense within my environment. What is your provider or your network provider footprint in my area? Do you have a network provider footprint? Is the hospital in my area contracted? Do I get the contract with a doctor that's already looking after the occupational health in my particular employer environment? So those are the factors that one needs to look at. It's not just making a decision, and eventually you have these things in silos of my occupational health in a silo, of my medical scheme in a silo, and how do I bring them all together? So it's good to make those decisions or assessments up front before you make a decision. If you have a very young group and they like to play football and they like to do other things and they're not into gym, it's very silly to have something that gives you a gym opportunity, just to give you an indication. Or I have a employer that use a lot of manual power that needs heavy lifting and they may need more physiotherapy. Is there physiotherapy that's contracted, physiotherapist that's contracted close by? So it's stuff that you need to think of when you do it. It's not to say that one scheme will fit all. What's the scheme's integration with other products that will make more sense for me? And then obviously with this COVID pandemic, it's just don't go without.
Okay, well, that makes a lot of sense. I never really thought of it that way before when it comes to medical aid. I didn't think about, I have to consider the kind of work that I do, or even for businesses. I mean, I'm thinking now as an individual, but if I had staff, I need to think about the kind of work that we do and would the health repercussions of that business be? So for instance, because I'm an office worker, I guess my medical aid would be different in relation to, because I work behind a computer all day, sitting in an office all day, that kind of things I would have to consider. So am I getting that right, listening to what you say?
Correct. And remember, it's not often that not only the scheme, you also need to unpack the options or the different option plans within that particular scheme, because that will also give you an idea of, does the scheme offer the cover within a plan option that I can actually utilize? What are the primary care needs that I need? Is it that I need unlimited access to a general practitioner because this is my primary port of call? That is what I need. The fact that I've only employed male and no females is purely because of the nature of my business. Uh, do I need obstetric care? Nobody's going to get pregnant unless I've also got cover for their beneficiaries. So as soon as you need to unpack it properly to make those decisions.
Okay, yeah. So that's really not a quick decision at all. Now, many employees would be able to provide, many employees would like to be able to provide access to private healthcare for their staff, but are concerned this may not be affordable, especially in the current financial climate. What are their options?
There are other options other than medical schemes, but often these are insurance-based products, and the insurance-based products may look more affordable initially, but the problem is that they all have rand value limits to what can be covered, and those are regulated. If you're then in an accident, your rand value limit will most probably move you into a state facility very soon, purely because you run out of benefits. Say you need an ICU for 2 or 3 days, that hospital type of cover would run out of benefits. So your medical scheme, if you can at all afford it, because of the PMB regulations, remains the cornerstone. So if you can afford anything, that is what you need to look at. If you can't afford it, then you may look for some cover at this others. And again, depending on your employee base, you may opt for something that just offers primary health care over and above your occupational health that you need to cover in it, because that will go a long way in sort of mitigating against the risk within your workspace.
Okay. Just want to quick give a shout out to Given. Good morning, Given, and Juliet. Good morning. Thank you for joining us. And thank you to Margie as well for joining us. And now you said something about occupational healthcare, primary healthcare. Is that different in costs, or what is the difference?
They're governed under different laws. So your occupational health falls under your labor act. So that if you're in a mining environment, certain pre-specified periods you need to test hearing, eyesight, fitness, and so forth. If you're in a manufacturing and it's a lot of heat, then you need to look at those types. So you need to look at what exposure. If it's noise, what is the exposure? You need to do hearing tests, and that needs to be covered by the employer. It's separate from a medical scheme cover, and it falls outside of the PMB regulations. But you often want to integrate that with your primary care. So, because my patient is, or my employee is one person, so if I can integrate it better, the better care that person will have. Say it's a diabetic patient. The diabetic patient works in an environment where there may be injury because it's a bit of a manual process. Then you need to make sure that you be able to care for that patient. The patient goes for the regular diabetes checkups, which are not an occupational health checkup, but will make sure that the patient's fit for work all the time if his sugar is well controlled.
Okay, wow, that's quite complex. I didn't realize medical aid was, I mean, I knew it was complex, but I guess if you don't speak to someone like yourself, it's very difficult to really cover or think about all the avenues. Yeah, good morning to Janine. Thank you for joining us. And then Sean, wow, I've been away from South Africa for so long. I forgot how important medical aid is and how blessed we are to have the NHS over here in the UK. Yes, I know, I agree. I've been in the UK for some time, and I know I'm very grateful for the NHS as well. Oh, so thank you for that. And so we're looking at what other health burdens and risks does South African workforce face? So what are the other risks that they face?
Well, if you just look at clinical risks, well, the biggest risk is not being insured. So let's park that one.
Okay.
So the other risks that you need to look at is it's your normal, what we call your infectious diseases risk, which are your typical malarias, your HIVs, your infectious diseases risk, which are almost unique to South Africa and can still be a burden. Certain if you work in forestry in the far northern parts of South Africa, or if you work in KZN in the northern parts, malaria is real. It's not something that you shouldn't consider within your environment. So it depends on what type of industry you are in, what type of cover you need. So we've got the infectious diseases, it's always in the background. And then we need to remember that we all move into an aging environment. And with aging and with bad habits, unfortunately, come other diseases. And that would be your typical lung diseases. And now, lung disease, we often think, oh, this is only related to smokers. It's not only related to smokers, it could be related to your occupation. Are you inhaling dust? What kind of dust? Are you in an open groove mine with a very specific dust exposure? And some people will have a genetic susceptibility to develop these sort of lung diseases, and others would be exposed to the same and they won't develop it. So 15 to 20% of people exposed to that risk may develop a specific lung disease. So that is the occupational part. Superimpose this with your bad habit of smoking, and you may have a double whammy. Add a little bit of TB in that environment, and you have that to cope with as well. So that is the smoking part. If you now look at cardiovascular disease, that's still your major killer in the world. If you now look at all the little balls they draw us in the COVID pandemic, cardiovascular disease on a daily basis still kills about 50,000 people every day globally. And I'm not saying we're going to, so let me phrase this correctly. Death is not optional, but how do I maximize my quality of life while I'm still alive? And that is making sure that I care well for myself. And cardiovascular disease can be postponed or can be altered by caring for yourself. And how do I care for myself? It's early diagnosis, early treatment, stay on the medication. It's not something that's going to be cured, it's something that's going to need control for the rest of your life. And perhaps one should focus on the Bill Clinton phenomenon. You don't cure a high cholesterol. I control a high cholesterol. And therefore, you need to take medicine for life. It's not something until it's normal. You can now stop the medication, and that's what Bill Clinton did, and was surprised that people got a bypass graft surgery. So it's something that you need to continue for life. And those are the diseases, those non-communicable diseases. Diabetes, I think, is the other one. And yeah, we look at, you talk about office work. So if I've, and they've seen it very well in America, how it developed over the time. We've seen it in Hawaii, we've seen it in the Middle East. As soon as you move from your diet and you move from sort of manual labor environment to a sedentary lifestyle, or become a clerk, or becoming somebody that do work, diabetes is a real concern, and that has escalated significantly. And as soon as you're diabetic, you've got all the other risk factors. So we need to consider all of that in the workforce as well.
Would you say, I mean, should one do a medical health test every year to safeguard your insurance, or and how vital is it? Like, let's say, for example, some people smoke and then they decide to give up smoking. Is it important to inform your medical aid? How does that work? Because could it work against you if, say, you haven't done that?
You should actually, at least on admission, screen your patients and or your employees, and then screen them on a more regular basis, especially those at risk. Uh, a lot of people don't know they're on risk. So we have these sort of health days, and it's a quick buzz and it's over. We've done research a couple of years ago where we've done at a huge petrochemical plant, looked at the workers, and we said, let your nurse that is occupational health, everybody must within a month or 3 months period go for a screening. And we did blood pressure, glucose, and a few other things. And we picked up a few patients that were unaware, but we also picked up patients that were already diagnosed by their general practitioners. But you see, high blood pressure and diabetes is often a disease given to you by your doctor. You don't go to the doctor and say, I feel so hypertensive today. It's discovered because you went to or itchy toe or whatever. So now the doctor says, I've got a disease that I never had before because I didn't know about it. So now
Yeah.
you want me to take a pill that makes me feel dizzy in the morning for the rest of my life. Really? You see, and that is to reinforce the good behavior. So your health day assist in that, but it should almost be on a more continuous basis. The health day or that event or the month of screening is to find the patients that need care, to find those on chronic care that need more assistance, and then to send them say, listen, your blood glucose is not controlled, your blood pressure is not what it should be. Please go back to your general practitioner, have a check, and come back in a month's time. I'll just check it for you. And if there's anything, I'll speak to your doctor. So that is the type of assistance that an employer needs to look at. If they've got a nurse, it's not expensive. Somebody that can be, if you've got a big setup, could be the employed. And if it's smaller, it's something that you can contract with a clinic. And there's a lot of corporate clinics out there that you can contract that will give that service. Happy that nurse, just make sure. I'm not interested in your value as the employer. Just make sure that the nurse says that you're still okay. That's all I'm interested in because I want to keep you healthy, that you're on the correct medicine, and you take it, and therefore you're not a risk to me and your colleagues that work with you.
Sure. That's a lot to consider. Gary Human says, this is a good question. I would also like to know if medical aid would cover the expenses of hospital care due to the COVID-19 infection abroad, as this virus will be around for a long time.
So if I understand the question is whether we will whether a medical scheme in South Africa will cover that for someone that's not in South Africa. So your medical scheme has got very specific stipulations on what they cover outside the borders of South Africa, and there's limits to that liability as well. So yes, they will cover hospitalization, and remember, uh, uh, COVID-19 is a prescribed minimum benefit, and it was gazetted as such, so it has to be covered. But because you're outside of the borders of South Africa, there may be in your specific medical scheme certain limits to liability for that. So there may be up to a certain rand value, but not necessarily the whole. So you must make sure of your medical scheme is what level of cover you will have if you contract COVID outside of South Africa. Inside of South Africa, they must cover it in full.
Okay, because Eve is also asking kind of a similar question on how do you cover for the pandemic, because she noticed that when she was looking for travel insurance that all of them didn't offer the cover for COVID-19. So travel insurance, I would imagine, would be different to the medical aid scheme. So you would, correct, would you have both? Or
you can have both, but you don't know whether that is an exclusion. So if you have an old travel insurance cover where they were unable to exclude it, it may still be included. If you now want to travel, if you're so lucky, the insurer may exclude this because it's a new threat, and the insurers are risk averse. They don't want to necessarily have the risk, so they would want to insure which they know and which they actually understand, and therefore you also have an insurance premium increasing with age because a risk with age travel increases. So that's a rand value limit that you will have, or not insurance. Whereas your medical scheme will have to cover you for the same conditions outside of the borders that you were covered inside of the borders. There may just be certain regulations or scheme rules that you must be aware of when you look at that. So they may want to transport you back. It's not possible anymore. So even the medical schemes will have to relook how do they cover that. So it's not a simple thing. It's often better just to phone and check with your medical scheme how that will be covered.
Okay. Another question that's come in is, what is the difference between a savings plan and a medical aid scheme?
A savings plan it's often a subset of your benefits within a medical scheme. So a medical scheme may have, I'm on option X, Y, and Z, and because I'm on that particular option, I have a savings plan. So a savings plan was developed many years ago as to say that let's put a rand value within a savings value, and as soon as it's a savings value, remember that money belongs to the member of that medical scheme. It doesn't really belong to the medical scheme. However, the medical scheme may have certain rules and regulations that's approved by the council as how you may use that money that's yours within your savings account. So that's often used to pay for day-to-day benefits, my general practitioner visit, my physiotherapy. So that would be typically your savings account. Savings account can only be used for covering what we call non-prescribed minimum benefit entities. So as soon as you go for your blood pressure checkup, which according to your general practitioner or your clinician needs to be done on a certain interval, 3 or 6 monthly, and you need to have that's a blood pressure is a prescribed minimum benefit, high blood pressure, and that should come off risk. That cannot be paid out of your savings account. So those are the things that people need to be careful and look at, as that when you've got a PMB, it doesn't come out of your savings account. Anything else, colds and flus and ingrown toenails and a cough now and then, that comes out of your savings account. Your back physio for your sports injury, that comes out of your savings account, but not your PMB stuff. That doesn't come out of a savings account. It's a subset of the money paid to a scheme that's set aside for these day-to-day benefits.
Okay, sure. So a lot to consider. So what else would you say employers could do to reduce their risks or to implement? Any final thoughts with regards to advice you can give people in general?
Well, if we're talking about an employer group, the first thing that you would do is to understand who works for me. And when I say that, it's my population demographics. Who are they? What are they? As I said in the beginning. And if I understand that, to make sure that I have a primary healthcare plan in place that will cover those type of people that work for me. So what's the problem? Is it predominantly female, be, and I then look for my medical scheme that gives me the best cover for those particular entities. And then you need to look at what's the secondary care that needs to be done. So if I detect a problem, so I cover female workers, so predominantly female, I'm in the sewing industry. So they would need antenatal, postnatal care. Do I get sufficient within the options of the medical scheme that I'm considering? Is it affordable enough, or should I look at something else? So clearly understand your employer group. It's important, and then a primary healthcare cannot be overemphasized.
Excellent. And coming to Health Square, what does Health Squared offer to people? Where would they contact you? What medical aid do you offer in particular?
Yeah, so Health Squared is a medical scheme registered with council, and people can go to Health Squared and visit their Facebook page or their website and to contact them on that. So they've got a Health Squared Facebook page, so healthsquared.facebook.co.za, and also on the if you Google, you'll come up with obviously the address for the web page as well. So Health Squared has 10 options where you can select from very high level of cover to sort of a very basic cover, which could either be just a hospital with just will cover P&B options, to a hospital that will plan that will cover some general practice visits as well. And then you also have a spectrum of middle option plans where you would look at patients with families, and then you've got sort of higher option plans for those patients that feel that they need, they've got more needs over and above only P&B needs. You've got other diseases that you want to have covered more. You need orthodontic therapy and so forth. Then you need to buy up into the higher plans where those would also be covered sufficiently. But it's comprehensive, and it goes over the entire spectrum of care. The one key element is that Health Squared then try, as with the administration, try to integrate, and has got it right to integrate with the occupational health, the primary health care, and the other options with employer environments, so that they specifically assist the employer looking at how do we take that forward, and how do we do the assessment and make sure that your beneficiaries within your employer environment gets the best care.
And with the COVID-19, what is Health Square's approach to funding, testing, and treatment for COVID-19?
Yeah, so we were one of the first schemes, or Health Squared, in that they covered the according to the Center for Disease Control. If you show symptoms, you need to have a test. Most of those tests will come out negative, especially if you're not in a highly or a hotspot area. What has happened initially is a lot of people went for testing and came up negative, and it came up from savings account. And Health Squared from the beginning said, if you're at risk and you think you're at risk, either by travel exposure in groups, or because of your symptoms, we will pay for positive and negative tests because it's the right thing to do. It later on became part of the P&B environment, so you need to pay for both of these. Even if it's negative, you have to pay for it. Yes, schemes would put in little authorization processes just to mitigate against abuse of that, but essentially they pay for all of the pre-test screening tests, which is a PCR test, just to make sure that the virus is there. And also, if you're then in hospital and you're negative and you're there because of need, so you had a heart attack, the hospital will screen to make sure that you don't bring in the virus. And often when you leave, they want to see if you had the virus, is that you're virus free, and therefore they will do another test. Those tests are all covered, as well as the treatment and the protective gear that the nurses need to taking care of your emergency treatment.
Okay. And I see just a last question here coming from Janine. She's asking if there's a savings plan with Health Square. Do you offer that as well?
Yeah, not on all the options. Some of the higher options have savings plans, and some of them will have hybrid plans where you can have either a day-to-day stated benefit and a savings plan adjacent to that. The pure hospital plans do not have savings plans, and what we call the foundation option, which is a P&B but unlimited general practitioners, that will also not have a savings plan. Some of the higher options then will have savings plans, obviously, where you can then have more flexibility around where you spend the money. The middle, one of the bigger options, your flex option, is a traditional option with stated benefits, but the flex tells you what it is all about. You have a decision on where you spend the money. So it is a traditional plan where it's a stated benefit, but the flexibility lies in that you can actually allocate the money to where you need it within that to a certain extent. So it's to compensate for for not having a savings account, but still having a traditional scheme where you're well protected.
Okay, well, we've now run out of time already. I just want to say hi again to Dirk. Thank you again for joining us, one of our regulars, and same to Sean from the UK. Thank you again for joining us. And on that note, we've run out of time. What I will do is I will post the link for Health Squared in the comment box below after this interview. Thank you so much, Dr. Snyman, for joining us. Any last thoughts where they can get hold of you should they have any questions to ask you?
I think it's just easy. Go to the scheme's Facebook page, put your questions there, and it will be then sent to me so that I can answer, and we can put that in writing for you.
Perfect. Thank you. So everyone, thank you for joining us today. Please remember to join us every week at 10 o'clock for discussions on a variety of topics. Should you have any suggestions, you can also let us know. We're more than happy to take on suggestions. And to remind you that FASA is a non-profit organization that protects, lobbies, promotes, and develops ethical franchising across all sectors within South Africa with a specific focus on transformation. FASA offers membership to both existing franchisors and franchisees who supports and runs ethical businesses. If you want to know more about FASA and what they do, please visit them at www.fasa.co.za. Thank you everyone for joining us and see you next week. Have a super week further.
Thank you.